Good evening and welcome to the very first edition of our COVID-19 pandemic update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. Today, COVID-19 confirmed cases in Nigeria climbs higher. Figures from the NCDC puts it at 782. Lagos residents defy lockdown order as yellow buses reappear on major roads. And U.S. Center for Disease Control Director paints gloomy picture of days ahead for America's healthcare systems. Welcome everyone to the program. Now let's bring you the latest figures from the NCDC on COVID-19 situation across the country. Total confirmed number of cases, as you already know, 782 with 197 deaths. Discharged persons, 197, and sadly 25 deaths have been recorded. When you take a look at the state-by-state breakdown, we're looking at Lagos that tops the chart, and a number of people referring to it as the epicenter, seeing as a huge number that has been added, and we're having it at 430 there, followed by the FCT with 118. Kano is next. There's a number of situations happening in Kano at 73 there, and we have in the southwest Osun, Ogun. We're having Oyo as well, 20, followed by Oyo State at 16. We're looking at other states like Katsina, Kwara, Kaduna, and Akwa Ibom, Borno also having 9 cases each. And when you look at Bauchi, 8 cases, Gombe 5, Delta, we're having 4 cases. In Ekiti, it's 4 as well. Ondo's recording 3. And just last night, we had 1 more case in Rivers. Jigawa still has 2 cases. Enugu has 2 as well, and so does Niger, also Abia State. Benue has recorded 1 case, Anambra and Sokoto 1 case as well. So let's take you to how indeed it all began, the journey of COVID-19, because these were not what it used to be, talking about the numbers now. And we have our correspondent here, Channels Television Health correspondent, joining us, Yomi. I mean, looking at how we started, yes, thanks again for joining us. Seeing the index case was reported. I mean, this is, I think it's about 7 weeks and 5 days so far.
So that's 28th of February. That was the day that the first case was announced, and, you know, everybody was okay. So it's finally here. But moving on from there, we went to March 9th, and that was when the second case happened. And then we moved on to March 17th.
But the interesting thing as well is that when we had that first case, there was a lot of contact tracing. There were so many numbers. I mean, there was, going to Ogun State, and perhaps that's what affected the lockdown much later, March 30, Ogun State, the FCT, and then Lagos.
Yes, we had the lockdown on March 30, but before then, you've mentioned contact tracing. So it started from Ogun State, but actually the patient was brought to Lagos for management. And since that time, the numbers keep growing. And by April 1st, we had the first highest number of cases, like we had 31 that day, and all of us thought that that was, high, but we've so far moved away from that, and as we speak today, you know what the numbers are.
782. So still taking us back to the point where we were totally confirmed cases at 70. We also realized that it was just in 9 states, and we've come quite a way from 9 to where we are, so about from 25 states.
25 plus the FCT. And so it's, we heard about last week that the cases might actually get to all of the states. And from what we are seeing, if we look at the case in Kano particularly, Kano started on April 11th, and that was when the first case was diagnosed there. And in 10 days, we have 73 cases in that state.
That's a jump.
It's a jump, and I think it also speaks to the fact that we all need to, get on board. And whether we are in Kano or Lagos, wherever we are, even in some of the states like Bayelsa that, they don't have any confirmed case yet, we all need to take the precautionary measures.
But I must ask one question. Looking at the number of cases that we have now, and we have only a lockdown in Lagos, the FCT, and Ogun State, should it be across all the other states?
Okay, so there's a lot of discussions around the lockdown. Even yesterday on our 9 p.m. show, one of the doctors mentioned that, the lockdown it's served its usefulness, because right now we are talking about community transmission, and that means individuals, we all need to take this, we all need to decide and say, we don't want this virus to continue. And so we all need to take responsibility. And if you look at that number, yes, we have 782 total confirmed cases. But that's not to say that those are the active cases, because a lot of people, when you hear the numbers, 700, or we are heading towards 1,000 or whatever the numbers will be, it is not this. Remember, we have to take out the 197, those that have been discharged, and unfortunately the 25 people who have lost their lives. So
the big question has been asked, and are still asking, even globally, a lot of people are asking and trying to increase their testing. Are we testing enough? Looking at our population, some say we've gone beyond these numbers, but look at the number of people we're testing.
So if you want to look at the percentage, you would know that we really are not testing enough. And everywhere around the world, we're talking about the reagents and all of the things that we need to test not being enough. But hey, we need to step up this game. And it's because some of these cases that we are now having, yesterday 117, it's because of the improved testing. And so we have Lagos State going into the community to go and look for the cases, and even in Abuja. And so if we do more testing, we might be surprised, some of the figures that will come up.
All right, we'd like to thank you, Yomi Otagbe, for joining us on this segment. Well, let's take you to Kaduna State, where it appears to be good news this time, as Governor Nasser El-Rufai tests negative for the coronavirus after weeks of strict isolation. The news came almost 4 weeks after he announced he tested positive for COVID-19 Saturday, 28 March 2020, on his Facebook page. Today, he thanks Almighty Allah for his grace and mercy, while also acknowledging the massive outpouring of sympathy, prayers and public support. He says he has now received the all clear after testing negative twice.
The evening of Saturday, 28th March 2020, I was notified that I had been tested positive for COVID-19 or coronavirus. I immediately made a public disclosure of this sad news and proceeded into isolation under the strict supervision of our medical professionals. I'm delighted to report today that after nearly 4 weeks of observing a strict medical regime, I have now received the all clear after 2 consecutive negative test results. I thank Almighty Allah for His grace and mercy. I also acknowledge with gratitude the massive outpouring of sympathy, prayers and public support that followed the disclosure of my infection. My family not only went through the trauma of potentially losing a member, but also the risk of being infected as well. The entire family has been supportive as usual, while my many friends and colleagues from across Nigeria and all over the world have sent their prayers and best wishes.
To him and the people of Kaduna State. Now, yellow buses, popularly called Damfo, are back in operations in Berger area of Lagos, defiant of the lockdown order of the federal government. People in the area say it is difficult for them to stay at home since no palliative has reached them. As a result, they say they're compelled to fend for themselves. Our correspondent Gimba Omar reports.
A morning with hundreds moving up and down in the lockdown, mostly in a rush. Babies and bags at hand, in total disregard of the dangers of a pandemic. Hawkers of food, drinks, including non-essentials, are all part of the ordeal. Crossing the expressway here in the Berger area is free, with no restrictions. Everyone moves hastily. Their focal point, the yellow buses. Getting on one is a struggle as social distancing is ditched. But can the situation be avoided?
Definitely, everybody cannot be locked down, but at least most people that did not have important things to do outside should stay at home to prevent the spread of the COVID-19.
While the yellow buses are back, the hopes of containing COVID-19 beckons. The police who are stationed here seem to swing into action on sight in our camera. The evidence, the initial free flow of cars is disrupted. 2 yellow buses take the fall. They are not the only commercial vehicles calling out for passengers in a busy setting.
Now 500. How much did they pay before? I don't know.
Car fares have doubled, we're told. And the worst, they say, is yet to come. Even motorbikes are defiant of the orders. The police get active and the riders disperse on sighting the approaching policemen. In the heart of it all, some say they can't afford to sit in.
You just keep up for house. We are hungry. We are hungry now. See now, sis. I just wake up around 5 o'clock. Come and sell food. No more to nothing. We are hungry.
For now, the numbers of infected cases continues to rise exponentially. Perhaps a change of strategy by the authorities and communicated to the defiant who disbelieve the potency of a virus that knows no boundaries, no borders, will help.
The sheer number of people and cars coming into Lagos via Berger is a major concern in curbing the spread of COVID-19. Gimba Umar, Channels Television News.
And more states continue to adopt varying measures to curbing the spread of COVID-19. Governor Amadu Umaru Fintiri today announced a COVID-19 index case in Adamawa State. He made the announcement in a statewide broadcast saying the index case was a returnee from Kano State last week. He said upon feeling sick, the person presented himself at the state specialist hospital where his samples were taken. It came out positive. He also says all apparatus needed for treatment is in place at the isolation center in Yola. Back in Lagos, the governor, Babajide Sanwo-Olu, has unveiled a new isolation center at the landmark convention center. That's in Lagos. The facility is equipped with 80 beds, 10 ICU, which will be used to take care of COVID-19 patients. Over to Edo State, where lawmakers there have donated their salaries for a month, 200 bags of rice, beans each to the state government as their contribution towards providing palliatives for the vulnerable society. Over to Imo State, the government has debunked rumors making the rounds that there is a positive COVID-19 case at the Federal Medical Center in Owerri. Addressing journalists in the state capital, chairman of the COVID-19 committee, Professor Morris Iwu, says the rumor is false and untrue. And finally, Plateau State government has quarantined over 80 travelers attempting to pass through the state, while the entry points have been closed following the lockdown directive by the state government. Still to come on our COVID-19 updates as the lockdown enforcement continues in Lagos, the Federal Capital Territory and Ogun. Human Rights Commission documents the incidents of violations allegedly perpetrated by security agencies and other actors. We have that when we return. Right now, a fellow of Royal College of Anaesthetists. He joins us from Sussex, Dr. Oluseyi Balogun. Thank you for joining us at this time as we talk about ways of limiting the spread of the pandemic. We understand that about 25 doctors have written to the Health Secretary due to concerns of the UK's advice of people to self-isolate for 7 days instead of the WHO recommended 14 days. Can you tell us what you think about that?
Yeah, thank you for having me today on your show. In the UK, we basically follow the guidance of the Public Health England. That is the body that regulates pandemics in the UK. The WHO is also a regulatory body for the whole world. Unfortunately, the regulations and guidance from the two, the WHO and the Public Health England, differ slightly in the isolation period. The WHO has advised that 14 days, anyone with symptoms or 2 negative swabs after the positive one. The Public Health England has advised that if anyone shows symptoms, the person should stay 7 days afterwards. However, if there is a family member who has symptoms, then the healthcare staff needs to stay 2 weeks. I think this discrepancy is not something we need to dwell upon so much, because there's no gold standard. There's no one rule fits all in this thing.
I must quickly ask you, sorry to cut in, and you play a crucial role in the success of a variety of interventions. As an interventionist yourself, I want you to quickly tell us your take on perhaps some of the interventions in Nigeria and what you think we're doing. What's your observation?
Okay, for Nigeria, what I would say is there are lots of fantastic doctors and hospitals in Nigeria. Nigeria needs to learn from the UK because we started a little bit late. If Nigeria gets their acts together and have a very good public awareness, the government should take the stand by getting enough PPEs on ground, enough adverts to inform people about what to do, what not to do. And to the citizens also, they need to take this seriously. I've seen a couple of people who are talking about hunger kills before coronavirus. If we take the personal, the isolation seriously, and also do the hand washing appropriately, avoid crowded areas, social distancing, isolation, if there's anyone with the infection around us, I think Nigeria will learn a lot and will be better off than what's happened in the UK.
All right, Dr. Oluseyi Balogun, we appreciate your time. Thank you for joining us on the program.
Thank you.
Now let's take a look at the report by the National Human Rights Commission on violation of human rights, talking about the lockdown states. The report shows that Lagos has the highest recorded cases of rights violation with 28 incidents, followed by the Federal Capital Territory, 10, Enugu State recording 9 incidents, followed by Abia, Delta, Nasarawa State recording 7, 6 and 5 incidents respectively. So out of total 36 states of the Federation, 105 complaints were monitored and received according to the Commission in 24 states, including the FCT. Some of the right violations were in areas of extrajudicial killing, violation of rights of freedom of movement, unlawful arrest, sexual and gender-based violence, among others. Well, joining us to look at this further is the Deputy Director, Investigation Monitoring, National Human Rights Commission, Mr. Iheme Richmond. Thank you for joining us at this time. First, briefly tell us how the Commission collated and also verified all the data.
Yeah, thank you so much, viewers, and good evening. The Commission has offices nationwide and how to deploy the monitors in all the offices nationwide. And hotline telephone numbers were also made available to the members of the public. And members of the public were asked to call those hotline telephone numbers in case they witness any violation, any human rights violation in their area, or in case they were victims of violations. So it's in that connection that calls were made during the first phase of the lockdown, during the first 2 weeks of the lockdown.
Mr. Richmond, it's also interesting, the report further showing 18 deaths recorded by the Nigeria Police, the Correctional Service and the Army combined. Disturbing statistics from agencies who are supposed to be protecting Nigerian citizens.
Come again? I didn't get it well. Come again.
Talking about your report, it said that it implicated the Nigeria Police Force, the Army and Correctional Service, that's formerly the prisons now, responsible for a number of deaths. Your report says 18 in total. It is very worrying. But tell us what indeed you're doing moving forward with some of this information that you have with these agencies that you've found complicit.
Yeah, indeed, the figure is quite worrisome. The figure of extrajudicial killing resulting from the enforcement of the lockdown from the security agencies, as you have mentioned them. So what is the Commission doing about that? The Commission has brought these reports to the attention of the respective security agencies concerned, and calling them to take appropriate action in the circumstance to investigate the allegations and ensure that the perpetrators are held accountable, to ensure that the perpetrators are brought to justice in order to cure the culture of impunity.
Quickly on the issue of domestic violence and several other abuses, seeing as the lockdown persists in Lagos, the FCT and Ogun State, what more are you doing to prosecuting them, seeing as some of the courts as well are on break?
Yeah, those are the respective violations that cut across torture, inhuman and degrading treatment, and domestic violence, amongst others. Each of them is being further investigated based on the facts of each of the cases.
All right.
Ongoing investigations are being carried on.
We appreciate your time, Mr. Hemi Richmond. He is Deputy Director, Investigation Monitoring with the NHRC. Thank you for joining us at this time. U.S. health officials are warning that a second wave of coronavirus cases in the country could be worse than the first. Director of the Center for Disease Control and Prevention, Mr. Robert Redfield, says the danger is higher as a fresh outbreak would likely coincide with the flu season. He says it would put what he calls unimaginable strain on the U.S. healthcare system. The NCDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory on the disease. Also, the live feed of the World Health Organization's website. Each moment, there are regular updates about the spread of the pandemic. We also have their strategies and the public health response at both national and subnational levels. Well, that's how we wrap up our COVID-19 special edition in collaboration with the Ford Foundation. We'll take you to the Presidential Task Force briefing that is ongoing in Abuja right now.